We'll be talking about the third domain, which is immediate and emergency care. Athletic trainers are educated to provide standard immediate and emergency care techniques to patients in need. They also identify when consulting with other healthcare providers is required. Athletic trainers are called upon to provide skills for immediate and emergency care, including performing initial assessments of the patient or client to determine his or her level of consciousness and severity of a condition, applying appropriate emergency illness and injury management strategies following a pre-established action plan such as CPR, AED, splinting, use of spine board, and controlling bleeding. Performing secondary assessments and applying appropriate management strategies for non-life-threatening injuries or illnesses include, but are not limited to, open and closed wounds, head trauma, environmental illnesses, shock, acute musculoskeletal injuries, spinal cord and peripheral nerve injuries, diabetic emergencies, and allergic, thermal, and chemical reactions of the skin. Athletic trainers are required to formulate a differential diagnosis based on the results of the initial and possibly secondary assessment and communicate the nature of the injury or illness as well as the resulting treatment plan to the patient and other involved healthcare personnel.
During sporting events, it is inevitable that eventually an athlete will get hurt, whether it is during a practice or a game. That is why it is very important to have an athletic trainer in schools. One of the most important roles of an athletic trainer is emergency immediate care. When an athlete goes down on the field, the athletic trainer is the first on the scene and determines whether they need to use first aid, CPR, an AED, splinting techniques, spine boarding, or if the athlete can move to the sidelines. After that, the athletic trainer figures out what the best plan of action is for that individual.